Hi, welcome to the show. I'm State Representative Denis Guyer. On today's show, we're going to have a four-segment show where we're going to be discussing something that's very important right now in September 2009, and that is what's known as the swine flu, or the H1N1 virus. Right now, I've been joined by Sandra Martin, who's with the Berkshire County Boards of Health Association. Sandra, good to have you here today.
Thank you for having me.
How about a little bit about yourself and what the Berkshire County Board of Health does?
Great. I'm a senior emergency planner with Berkshire County Boards of Health. Berkshire County Boards of Health have been helping boards of health in Berkshire County for more than 75 years.
Wow.
We're one of the oldest professional organizations for boards of health in Massachusetts, and we've been helping boards of health do their jobs better. And Massachusetts is a little bit different than most of the country. It has county health systems, but here we do it all town, city by city, town by town. So coordinating this is really important, and we're seeing that now with the H1N1 outbreak, that we need to talk to each other, coordinate, work together, because disease does not respect town or city lines, of course. So that's what I do.
It didn't respect the border between Mexico and the United States.
It sure doesn't, or the world. That's
world.
why we call it a pandemic. It's everywhere.
Interesting. So we're going to talk a little bit in this segment about the epidemiology behind the H1N1.
In general, H1N1 virus, influenza virus, circulates probably every year in some form in the United States, in the world. This is a novel version of it. It means that it's new, that our bodies have not seen this virus before, and that's why we're having this reaction that a lot more people will get sick and a different demographic will get sick. Virus is notoriously unstable, the influenza virus, and so it will shift and drift a lot, millions of times during a year.
You mean in making changes to
making
itself?
Small changes, they drift and shift, and so the little incremental changes or big changes, millions of them come and go, die, never do anything. But the one or two that has that opportunity with just the right combination of ability to grow and reproduce and infect and not kill off the host too quickly becomes a novel influenza virus that becomes, in this case, a pandemic. And this is happening all the time. And it happens right now, this so-called swine flu. What happens is pigs and humans share a lot of the same influenza viruses. It's very easy for pigs and humans to catch the influenza from each other. And then inside the pig, the viruses mix as they replicate.
Interesting.
And these replications and mixings are what cause these novel viruses to happen.
So it comes back out of the pig.
Comes out of the pig. Pigs sneeze and cough just like humans, and transfer the virus to their human caretakers, and it mixes and drifts, and eventually we get what we have today. Now, the virus we have circulating is a human-style virus. I won't say a pig can't get it from a human, but it's not that easy to transmit. This is definitely a human virus.
So let's just break away for a second. Can I get this? And I'm just being, I guess, maybe a little sarcastic, but I can't get this from eating a ham sandwich.
No.
I can't get this from...
Unless you get in the face of a pig and it sneezes on you, you're not catching any of these things. And the same with the viruses that circulate through the chicken population, the avian viruses. Unless you manage to get the droppings of a bird somehow into your system, you're not going to probably catch it either.
And so the problem is that, like in our country, I know because I represent a lot of farms in my district, so I'm on farms a lot, and the farmers here in the state, and I'm sure in many parts of the United States, or most parts, are very careful about, like if I go into a barn, in most of my farms, there's going to be a hand washing station and like a Purell
Yes.
bottle thing to hand sanitizer, because we're aware of that, and there's some inspections and cleanliness regulations on having animals. Not true in many other parts of the world.
And that's one of the reasons you get the mixing happening in the Asian countries or the less developed countries, because they live very close and personal with their animals. So that mixing we talked about between people and animals happens more easily when people live right next to their animals. So it's not that we couldn't develop this mixing in the States. We could. It could happen here, and it probably has happened.
Interesting.
But the zoonotic diseases like this, which is a disease that infects people and humans, it's a transfer. Those precautions that you mentioned are very good.
Okay. So speaking of precautions and things, what is the Berkshire County Board of Health Association doing locally?
Well, in Berkshire County, we have lots of small health departments, not like Pittsfield Health Department, that don't have infrastructure. And so we're basically helping the boards of health develop the infrastructure to deal with this vaccine distribution and dispensing. So we've been instrumental in getting the groups together that need to get together, talk about it, decide how they're going to do it, and make sure that everybody in the county is covered, has access to the vaccine if they want it, and has the opportunity to learn about it and prevention methods. And so it's basically we're cheerleaders, and we are also helping facilitate the response.
So we were talking about this a little bit before we got started. This year, if you want to have a flu shot and you want to be protected from H1N1, we're talking about how many shots?
Well, for adults, the good news is, as of this week, that it will be one shot for adults. For people under 10 years old, unfortunately, they're still saying 2. So if you want the maximum protection and you're under 10, sorry, it's 2.
Oh, that's not good news.
Not
for
good
people
news.
with
Not
young
good.
children.
For the rest of us, though, very
Yeah.
good news. We were not looking forward to trying to get everybody through twice.
Yeah, that would not have been.
It would have been, it would have taken a difficult situation and made it almost impossible.
Interesting. How many people do you think, do you have a number of how many people are involved in the front lines of this thing? Locally?
Well, I would like to mention another statistic
sure, go
first,
ahead,
which
yeah.
is that in Berkshire County, we probably have more than 50% of our population in a priority group for the vaccine, because so many people have underlying health conditions now. And so, and a large percentage of our workforce is involved in the medical community. So basically, priority populations now in the Berkshire County are over 50% people who would qualify for the first round of vaccine, and then of course 100% of the people qualify for when it goes general to the public. In general, I think that in the county we are very fortunate that we have lots of cooperation among the boards of health, and so we don't really anticipate any real issues around planning for this.
And you said 50% of the population?
It's more than 50%.
And what's a priority group?
Priority groups are pregnant people. Children under 6 months of age cannot get the vaccine, but all the other children above that, up to 25 years of age. People with underlying health conditions.
What would be an underlying health condition?
Asthma,
Asthma.
which is a huge issue in diabetes. People who have had heart conditions or have gotten any kind of lung condition. Smokers. People with,
even if you don't have a
if
illness?
smokers tend to have some other underlying conditions, they may not be aware of them. So in general, when you count those groups along with the medical providers and healthcare workers and daycare workers and so forth, it's over 50% of the population.